We're working in-depth coverage now on Eyewitness News at 6:30. Governor-elect Gina Raimondo has picked outgoing Lieutenant Governor Elizabeth Roberts to be Rhode Island's next Secretary of Health and Human Services and charged her with reining in the state program known as Medicaid. Now joining us now to explain why it's at the top of the new governor's to-do list is WPRI.com reporter Ted Nesi. And Ted, for people at home, what is Medicaid and why is it such a big deal?
So Medicaid provides health care to poor Americans, and it's been expanded repeatedly, most recently by the president's health care law. The state covers about half the cost and the federal government covers the rest. The problem for Rhode Island is that Medicaid spending has been going up much faster than state revenue, which is part of why the state is facing big budget shortfalls. Medicaid will cost $2.7 billion this year in Rhode Island, eating up 1/3 of all state revenue.
So where does all that money go?
So last year, nearly 25% of Rhode Islanders used Medicaid at some point in the year, about 230,000 people. Most of them are lower income adults and children, but one confusing thing about Medicaid is there's a big difference between who's on the program and where most of the money is spent. Those low-income adults and children are relatively cheap to cover. Elderly and disabled Rhode Islanders actually eat up more than half the money Rhode Island spends on Medicaid each year. A lot of it goes to pay for nursing homes and other long-term care.
So what are some of the ideas out there to reduce the cost of Medicaid?
Well, the state's been wrestling with that for a long time, and it's not easy. Only 16,000 of the Rhode Islanders on Medicaid used more than $1 billion in Medicaid benefits last year. That's roughly $66,000 each on average. Many of them have multiple conditions that are hard to treat, so the state's looking at ways to keep more of them at home, which can be less expensive, but the clock is ticking to find solutions because the state's budget deficit is projected to top $400 million within 4 years.
Wow. All right. Thanks so much, Ted. And if you want to learn more about this issue, check out Ted's article, 12 Things to Know About Medicaid in Rhode Island, right now on WPRI.com.